Hey there, today we're diving into a fascinating world of brain health, specifically how repeated impacts to the head can sometimes lead to some tricky neurological troubles. You might have heard of concussions, but did you know that multiple head traumas can cause a condition called chronic traumatic encephalopathy, or CTE for short? It's a neurodegenerative disorder linked to repetitive head impacts often seen in athletes and folks with a history of brain injuries. Now, CTE isn't as though player in the game. It can present with a variety of symptoms, including cognitive issues like memory problems, attention difficulties, and slow thinking. Behaviorally, some folks might experience impulsiveness, explosiveness, rage, or impulsive outbursts. Mood swings, depression, and anxiety are also pretty common, making mental health a real concern. As disease progresses, individuals might develop signs of dementia, ranging from mild forgetfulness to severe memory loss and functional decline. Speaking of dementia, is a broad term for cognitive decline, severe enough to interfere with daily life. Alzheimer's disease, probably the most well-known type, but dementia can also result from other neurodegenerative diseases, including CTE. These conditions often involve the buildup of abnormal proteins in the brain like tau and amyloid, which form tangled structures called neurofibular tangles and plaque. Tau protein in particular plays a big role here, and the normal circuitous tau helps stabilize microtubules in neurons, especially in hippocampal and cortical neurons. But when tau becomes hyperphosphorylated, think of it as overphosphorylated tau, it mislocalizes and aggregates into insoluble fibrils, forming tangles that disrupt neural function. This process is influenced by phosphorylation at specific sites involving enzymes like kinases such as cedrin and terminal kinase, which adds phosphate groups to tau. Repetitive head impacts create stress waves and cause diffuse axonal injury, damage to the axons or the communication highways of the neurons. This can lead to microtubule disorganization, axonal transport problems, and even axonal sprouting or neuronal death. The damage isn't just confined to neurons. Glial cells like astrocytes and microglia also get involved, sometimes leading to gliosis or glial fibrillar acidic protein activation. On a histopathological level, affected by CTE often show white matter refaction, cortical atrophy, cavum septum pellucidum, and sometimes a dilated perivascular space. Advanced technologies like semi-quantitative p-tau pathology scoring and neuroimaging help researchers understand disease stages from subtle mild changes to severe dementia. In addition to cognitive and behavioral symptoms, traumatic brain injury and post-concussion syndrome may cause headaches, visual and hearing disturbances, weaknesses, tremors, or ataxia. Some individuals experience neuroendocrine dysfunction, such as hypopituitarism, growth hormone deficiency, adding another layer of complexity. While this might sound pretty serious, ongoing research into molecular mechanisms like tau phosphorylation, amyloid processing, and the role of enzymes such as secretases aim to find ways to prevent, detect, and treat these neurodegenerative conditions. So whether you're an athlete, a healthcare professional, or just curious, understanding the impact of head trauma on brain health is a crucial step toward keeping our minds sharp and healthy.